Assalamu alaikum. Hernia problem, symptoms, diagnosis, and treatment options of hernia. Definition: an abnormal protrusion of contents of closed cavity through a potential or an abnormal opening. This is called hernia. This is showing on the left side. Types of hernia: epigastric hernia, lateral hernia, inguinal hernia, femoral, inguinal, and umbilical hernia. What is an inguinal hernia? An inguinal hernia occurs when intestine or fat from abdomen bulge through lower abdominal wall into inguinal or groin area. Symptoms of inguinal hernia: pain after standing long hours, weakness, heaviness, or burning in the groin, discomfort or pain while bowel movements, pain while lifting heavy objects, pain while bending. These are called symptoms of inguinal hernia. Direct versus indirect hernia. Direct hernia due to heavy lifting or straining protrudes through back wall of inguinal canal. Indirect congenital protrudes through the inguinal ring. This is called indirect. Causes and risk factors of inguinal hernia: increased stress in the abdomen, an old weak spot present in abdominal wall, straining at the time of urination and bowel movements, heavy lifting, fluid in abdomen or ascites, pregnancy, overweight, chronic sneezing and coughing, family history, aging, and premature birth. These are called causes and risk factors. Hernia diagnostic test: physical examination is the most important. Imaging test: CT scan or MRI, herniography, endoscopy, and blood test. Lifestyle changes to prevent hernia: maintain body weight, wear hernia belt, avoid smoking and drinking, treat constipation, control blood sugar level, control persistent cough. Types of hernia repair: surgery. Open surgery: surgeon makes single incision and bulging hernia tissue is either removed or pushed back of the body. Laparoscopic surgery: surgeon makes multiple small incisions and inserts a thin lighted tube with camera to see, instruments, and other incisions to repair the hernia. Advanced laparoscopic inguinal hernia repair can use larger mesh, less pain, better cosmesis, fast recovery, less chance of hernia in back, less wound infection chances. Intra and post-operative complications after transabdominal preperitoneal hernia repair: intraoperative bleeding or lesion of vessels, lesion of nerves, bowel injuries, urinary bladder injury. Early post-operative complications: hematoma or seroma, urinary retention, infection, wound infection. Late post-operative ileus or orchitis, trocar hernia. Thank you.